Hello, I'm Debbie Arnold.
And I'm Dee Anderson.
And today we have a hair-raising show. We have the wonderful Dr. Kai, but we also have lots and lots of other hints and tips and little bits and pieces that will make you look younger and feel younger. Beautiful. Keep watching Beauty Investigates.
Now joining us is the delightful Dr. Kai.
Hello.
Now, Dr. Kai, what a gorgeous name, what a gorgeous face, but most of all, what gorgeous boots.
Thank you very much.
I'm so sorry, I'm obsessed with people's feet at the moment.
You certainly are, but I must say they are particularly lovely.
Thank you.
Tell us how you started in the hair industry.
I'm a GP by background and I got into aesthetics in 2012, so quite a while ago, and I went down the regenerative aesthetic route, so I do hair, but I also do skincare. And the newer treatments that have come out that we're going to be talking about fitted very well with hair growth and hair loss. And as a GP, I still work in the NHS, and I'm seeing lots of people with hair loss. And most treatments, unfortunately, either work to a minimal degree or they cause lots of side effects. So I started looking into what's out there that isn't available in the NHS.
Wow. Can we talk about exosomes, please?
Yes, absolutely. So exosomes is one of the treatments that I use for hair loss, and it's a product that's microneedled into the scalp. So we have treatments like polynucleotides and we have treatments like PRP that are injected in. The exosomes are microneedled in. The reason I like that is because the microneedling process itself stimulates hair growth, and then you've got the use of the exosomes.
So how does it actually work?
But essentially exosomes are what we call extracellular vesicles that come off cells within your body. Okay, way back when they were thought to be waste products, and then they realized actually they're like messenger molecules. So they carry important information to the cells that need regeneration, and they take the nutrients, to put it simply, to the right places. So we use exosomes for skin and we use exosomes for hair. And the one that I'm talking about today is for hair loss. They've got growth factors, they've got anti-inflammatory factors, and lots of different signaling molecules to help with hair growth and stimulate hair growth.
It sounds so incredibly technical.
Yes.
Could you tell us, in sort of layman's terms,
Yeah.
what this actually does?
Yeah, when I microneedle the scalp, I'm going to a level where the hair follicle sits. I'm then placing the exosomes on top and allowing them to seep through those microneedle channels. This then gets to the follicle and it supplies everything it needs to grow your hair. I use it in a range of different hair loss types, including myself when I used exosomes in my own hair.
So whereabouts have you used exosomes in your own hair?
So just here.
It's incredibly thick and beautiful.
So my hair is very, very thick. It's so thick that I've actually shaved the back of my head. I can
Wow.
show you there. But I did have significant hair loss. And for me, it was after a stress event.
Yes.
And what people don't realise, again, when you're speaking to someone that's trained in hair loss, is the stress event might not have happened immediately. For me, it was about 4 or 5 months ago that I had the stress event, and the hair loss was after that. So people don't associate it with it. So you need to take a good history when you're looking at someone with hair loss. And what I'm doing then is that I'm injecting the right things. I'm changing their nutritional balance, and there's a lot that goes with it. It's not just the exosomes.
Okay, so if I came to you, because I've got this is just sort of going here,
Yeah.
and I've just gone through a trauma.
You have.
We'll talk about that another time. But so what would you say to me? What do I need to do?
Yeah. So the first thing that I'd do is I'd go through your diet in detail. And I think this is really important because if we're looking at regenerative, holistic approaches to things, which is my key, then I have to look at what you're eating. I want to get a blood test because yes, it could be a trauma that caused it, but there's also a whole other range of things that can happen. If your thyroid is off, if you don't have enough zinc, your iron levels. So I tend to tell people to get a blood test first. I'll have a look through the results and see if there's anything there that I can improve as well. And then at the same time, I'm going to be using the injectables. But if people could afford only one thing and I could only give them one thing, I'm going to go for exosomes.
Right.
That's the most expensive of the lot as well.
Yeah.
And then what are we
But it's
talking
worth
about
it.
expense-wise?
Each treatment is about £430. And then I price that for 3 treatments with some home care. But the home care serum that I'm giving in my treatment plan is worth £250 because it's also exosomes.
So I thought I would copy Pamela Anderson and do the no makeup thing just for a day. So I step out of the front door, no makeup on, and there's my neighbour who kind of squints at me like she's trying to solve a puzzle. Then later I'm at Tesco's, standing in the queue, and this man in front of me sort of gestures for me to go ahead. Doesn't say anything, just sort of waves me forward like I'm some sort of charity case. I didn't react. I just stepped forward, paid for my oat milk in silence, and then I got on the train. And 2 people offered me a seat. 2! One of them barely looked up from his phone. He just sort of nudged the seat with his knee. Go on, sit down, you poor old thing. I didn't take it. I just stood there, clutching the rail, staring straight ahead. Then I get home. No makeup to take off, no skincare routine, nothing. I just stood in the bathroom. I thought, well, that's that then. I glanced in the mirror. And yeah, I didn't like what I saw. I looked like a sort of Victorian ghost that hadn't quite moved on. Oh, Pamela! You're rocking the no makeup look and making it look effortless, whereas I do it and people start a GoFundMe page for my recovery. I think I'm going to take all your tips and I am going to do this in the future and not wear any makeup, but only when I'm indoors and with the curtains shut.
Hair is very important to people, isn't it?
Yes, yes. And I think one of my biggest bugbears is when people have come to see me and they've gone somewhere else and they've trialed something and it hasn't worked, is the unrealistic expectations. So in your case, yes, so like I said, I'd go through your nutrition and then I'd talk to you about the different options that are available for you. If it's purely related to stress, stress-induced hair loss can be self-limiting, so it can come back. But for some people, this can take 18 months before it comes back. And that in itself is very stressful. And if you're repeating that stress cycle, it can take longer for that hair to come back. And that's where treatments like PRP, treatments like exosomes can really help.
And I don't think actually £400 a treatment is that expensive.
To some people it is.
Yeah, but I don't. It's what you get for it.
Yeah. I think if they're going to come to you,
Yes.
then they're ready for the lifestyle change as well.
Yeah.
Yes, and they have to be. I mean, even as a GP, I'll often see people that are coming in and they want treatment for something, and I'll discuss lifestyle with them.
Yeah.
People want quick fixes, and for me, I won't do that. I'm going to be really honest with them and say, look, if you're not going to use the home care, and if you're not going to, follow the certain lifestyle advice that I give you, there's no point in you paying for this, because it's not going to work for you.
Why is it with men though? They've got big beards and no hair.
It's where your androgen receptors are, and where it gets affected. So that's on the head, unfortunately.
What do you feel about the future in terms of what you're doing now? Where is this all going for you?
I think, for me, I'm already doing a podcast on longevity, and for me, it is all about regenerative aesthetics. And I think, and I know you've had a few guests on that have talked about how, fillers, we're moving away from fillers and we're going towards polynucleotides and exosomes. Exosomes are used in the skin as well. And for me, that's where I'm heading. And hair loss is my biggest client base. And so, yeah, that's sort of where I'm going with it. It's the future for me is training people in hair loss and making them understand that, hair loss isn't just about the hair. There's a big psychological impact with hair loss.
There is.
In menopause, it's not just the estrogen, it's also the stress. So, you've got so many combinations that cause hair loss, and understanding that is key in which treatments you select. Vitamin A deficiencies causes significant hair loss, but if you overdose on vitamin A, that causes hair loss.
So you've got to be right in
Yeah.
that.
Exactly. This is why everything's bespoke for
Yes.
you, isn't it?
Yes.
Everything is like personal.
Yeah.
But tell me about when you go to the hairdressers.
Yes.
I mean, colouring stuff that they use on your head, all of this lot, does that contribute a lot to hair loss too?
Yes, particularly when you're starting to notice your hair's breaking at the ends. So anything you put in your hair is going to contribute to hair loss. I used to straighten my hair all the time, and it was dead straight. I would never have it curly. But then when you look at people that have straightened their hair repeatedly, if you look at their hair under a microscope, eventually it starts to show signs, and there's something called bubble hair, and the hair actually looks like it's bubbled out a little bit. And so that's going to be brittle, that's going to snap, and it's going to be shorter.
But so really, you should be working with hairdressers as well.
Yes, I absolutely agree, and that is something that I'm looking at the moment, is speaking to hairdressers and talking to them about how we can work together.
We may be able to help you with that.
Yes, because we're connected to the Good Salon Guide.
Excellent.
So
yes.
we would love to introduce you to them. And
Yes, brilliant.
I think we need someone like you.
I do
because
too.
Yeah.
I think it would be so nice to go to a hairdresser who looked at your hair and said, right, we can do it, but also let's look at the whole picture.
I'm going to tell you a secret. The secret which will give you the hair of your dreams, and that is going to bed with a silk turban on your head. I am absolutely obsessed by this one by Slip. It is amazing, and it's what all the Hollywood starlets used to do back in the day. Silk basically helps keep the moisture in your hair. So whether you have curls and coils, or straight hair, or textured hair, you will look amazing. I'm going to spoil it for you, but when you go to bed on cotton sheets, the cotton sucks the life and moisture out of your skin and out of your hair. So silk, I know it sounds very decadent, and it is, but you will have the best hair of your life. No more knots, no more bedhead, it will make you look as if you've had a power blow dry, and it is amazing for keeping my brand new braids in check. Also, I love silk hairbands as well for ponytails, so you don't get any ripping or tugging. Silk all the way. This is Silk Works. This is Slip, and if you do anything, invest some silk for your hair.
Okay, so now we're going to see some exosomes, I can't believe I've said that right, being administered.
Yes.
So what I've already done with Martha is I've analysed her scalp and had a look at to see how the follicles are and if there's a chance that this will grow back, okay? And in Martha's case, yes, very, very high chance. Martha came to me because she's starting to thin at the top and at the front. So this is a very common area for women to start losing hair. The next place that people tend to notice it is actually at the parting. The parting becomes wider. Okay, so now we're going to start with the exosome treatment. So to start off with, it's really important that the scalp is clean. Now Martha's washed her hair this morning, and I always ensure that my clients have washed their hair before they come to me, because I don't want to be injecting any product that they might have on their hair shafts.
Does the hair grow back a different colour?
So for some people, the hair grows back darker.
Wow.
So yes, so that's interesting. Your
No
greys
greys.
can sometimes reverse. Yeah.
Gosh.
So not for everyone, but some people have definitely seen that.
Yeah.
I didn't, so I still dye my hair, but but
Do
for
you
some
dye
people,
your hair?
I do. I've got a big patch here that grows like this. I put it on my Instagram,
Me
and you
too.
can see it.
Here.
Yeah.
I've got a big patch too that goes over my whole head.
Right, Martha. So this is just going to be very cold. Okay. Okay, and I'm going to get this side as well. Do you tend to sleep on this side more than that one?
That side,
That side already.
I sleep on my face.
Yeah.
Yeah, try and sleep on your back, everyone. It's the anti-aging method.
I like sleeping
Yes,
on
it
my
is.
face.
Yeah.
I do like sleeping on my face.
So this is the exosomes that I'm using. I use the ones from Dermapen World. It's a clear liquid that you can see in there. I use this for precision because this product is very, very expensive. I don't want to be wasting this on the hair shafts. I want this to be on the scalp. This is my microneedling device.
So, Kai,
Yes.
what advice would you give to somebody who's just started to notice hair loss?
The first thing I'd say is try not to tie your hair back tightly, because that's going to start pulling the hairs out. Try and keep it as loose as possible. There's lots of social media saying don't wash your hair, don't brush your hair. Absolutely, don't, just ignore that, okay? You want to be brushing it because you want to stimulate the hair. You want to stimulate the blood supply and increase all of that to each hair follicle. If you stop washing your hair, the bacteria is going to build up, the inflammation within the scalp is going to build up. So on average, I say wash your hair every 3 days is a decent amount. But again, it varies from person to person depending on how greasy your hair gets. So that would be my first advice. This is Martha's very first time having this done.
Oh, she's a virgin.
So, absolutely. So Martha, you can be honest about how it feels. And obviously it's microneedling, and you know,
Hopefully not
this
too bad.
pen has 16 tiny little needles in them. And this is microneedled in, but it's needled at a very fast pace, and it's not too deep. Okay, each time someone comes, I might increase the depth a little bit, but it depends on how much they're bleeding. They don't need to have profuse bleeding, just a little bit.
How often do you need to have it done?
Very good question. So between once every 2 to 3 weeks is what we're aiming for. And after the third session, I wait about 2 weeks before I do the after picture, because then I can see what the results are. And then after that, we define whether or not we keep going.
So do people respond differently to the treatment?
Definitely, yeah. And that's like absolutely everything. You know, HRT, everyone responds very differently. So that's the sound of the pen, it's very loud now. Long hair versus short hair, you've got different techniques of how you'll microneedle.
So Martha, why are you having this done today?
I noticed my hair thinning about 2 years ago. I used to have a heavy Claudia Winkleman style fringe, and I can't have that anymore. I've ended up cutting my hair quite short because I noticed it was getting a bit thin. And then I spoke to Dr. Kai, and she was saying sooner rather than later is better than waiting. It's not very significant, my hair loss, but I've definitely noticed it myself, especially around this area where she's treating now.
Yeah, the hairline, it's like where I've got it too.
Yeah.
I mean, I think there is kind of a lot of stigma attached to hair loss. I mean, we are lucky in the fact that we've just got it here so we can actually hide it. But I think a lot of women who get hair loss on the back of their head or on their passing, when the passings get wider and wider, I mean, I think it's very bad for your mental health, actually.
I think that's key, especially when I'm seeing women, is to give them realistic expectations. So I don't tell anyone this is guaranteed to work for you. What I do say is, yes, I'll see some difference because the product itself is going to promote scalp regeneration. Your scalp's going to look healthier. But I never tell someone this will definitely work for you, because the stigma behind it and the mental health effects of hair loss is huge, not just for women. And I think that's key. You know, I think men are expected to sort of laugh at it and get over the fact that they're becoming more bald. And I think it's really important to understand that I see so many men that are really upset by their hair loss, and it really affects their sort of confidence, and so it shouldn't be taken lightly. And this is why, again, I stress the importance of individualised care and taking your time with people. And you know, there was a study done not too long ago on cancer patients, and they talked about what the biggest impact and effect was on their entire treatment, and it was hair loss.
That's the first question they ask normally.
Yeah.
Women especially.
Yeah.
How, did it hurt?
I was really pleasantly surprised. It's like really mildly uncomfortable, but I wouldn't even say it was uncomfortable.
Really?
I was able to converse, wasn't
I
I?
want it done then. No.
Could take a seat.
So you've just done it here and here. That's all you're going to do to start with.
So Martha doesn't have any hair loss problems anywhere else, so I just target the areas that I'm going for. If you look at the top of her hair, she's got a brilliant head of hair. The parting is amazing. It's only here that she's starting to get some thinning. And when we looked at it under microscope, you could see that the hairs here are thin. The actual individual hairs are significantly thinner than the top of her head.
What would you advise Martha to do at home?
This is the tonic. So this has got amazing evidence. In fact, it's been compared to topical minoxidil and come out significantly better.
What is topical minoxidil?
Topical minoxidil is used for hair loss. In the NHS, we can, well, I can't prescribe it as a GP yet, but in secondary care they can. And this has been proven, study after study, to show that it works significantly better. And then this is a scalp mask, also, and these have all got exosomes in them. And this scalp mask, I want you to put it on for 10 to 20 minutes before you have a shower. Leave it in and then wash it off. And those are your little gifts for coming on with me. I've actually got some gifts for you too as well. These are eyelash serums, also with exosomes, so got the same sort of ingredients as the one I'm using for the hair here, and this changed everything for me.
Wow.
So,
thank you so much.
These are,
Looking at your lashes.
my eyelashes are super long now.
Oh, they are beautiful.
But I noticed sort of from 38, maybe 37, I'm 40 now, I noticed my lashes were getting, they were not growing as much. They were definitely a big difference. And then I got the hair loss that I showed you the images of. So I went into this.
It's really interesting.
Amazing.
Yeah.
Apart from people on chemo or whatever, is there anyone, Kai, who can't have this treatment?
Yeah, so active chemotherapy, as we mentioned. Pregnant people, we can't use it in just because we have no studies in them. So there's not any known risk, but we can't use it in pregnant people. And if people have autoimmune conditions and are active in their autoimmune conditions on immune suppressing therapies, then we can't use it. And that's mainly because of the risk of infection.
Because with thyroid problems, of course, you can lose your hair as well.
Yes.
And can this work with that?
Yes,
Oh,
and you
wow.
can use this with thyroid medication. You want to correct the thyroid first, because that in itself might bring your hair back. So if someone came to me and their thyroid isn't corrected, I'm not going to say to them, well, let's use the exosomes, unless they really want it. I'd say, well, let's correct your thyroid first, see if that works for you, and then spend the money on the exosomes.
Brilliant.
Great.
Brilliant. You've been a fantastic guest. You
Really
have.
amazing. And
we
thank
want-
you.
I want to go and see her.
You're going to,
I'm
yes.
going to go and see you to see what we can do with this bit here.
Yep, no problem at
Oh,
all.
yes, I've
Thank
told
you.
everybody about that now. We will see you again on Beauty Investigates.
We will.